Hey everyone, welcome back. Are you ready to absolutely crush the CPC exam? Welcome to part 23 of our 100-part CPC exam series. Now before we unlock today's high-yield secrets, I need you to do a quick favor for me. Make sure to like, share, and subscribe to Decode Healthcare with Harshal. All right, let's get right into the explainer.
So let me ask you a pretty serious question. Are you losing points on the global surgical package? Because honestly, if you are, you're definitely not alone. It is literally one of the most heavily tested concepts on the entire CPC exam. But don't worry, today, this explainer is going to give you the exact rule and exceptions framework you need to pass this section with flying colors.
Okay, let's dive right into this. Here is the absolute golden rule you have to remember. The CPT surgical package is what we call a global concept. So what does that actually mean for us? Well, it means if a service is considered routine and expected as a normal part of a surgery, it is completely bundled into the main surgical code. You absolutely cannot bill for it separately. Trust me, unbundling routine care is a fast track to failed exams and denied claims, and we definitely don't want that.
Let's draw some very clear boundaries here so you know exactly what we're dealing with. First off, what is strictly included in the package? Well, this covers things like pre-op evaluation and management, or EM visits that happen on the day of or the day before a major surgery. It also bundles in local anesthesia, the actual intraoperative procedure itself, your post-anesthesia care unit, or PACU, and recovery care, writing orders, and of course, routine post-op follow-ups. All of that is bundled. But what's not included? Things like the initial evaluation where you actually make the decision for a major surgery, distinct diagnostic procedures, unrelated EM visits, distinct surgical procedures, and unplanned returns to the operating room, or OR. Those specific things can be billed separately.
Now, what's really interesting about this is how the post-op care window literally expands based entirely on the complexity of the procedure. So, for a 0-day global, which covers minor endoscopies, the care is only bundled for the day of the procedure itself. A 10-day global applies to minor surgeries and, as you'd guess, covers 10 days of post-op care. But for a 90-day global, which are your major surgeries, it includes one pre-op day and a massive 90 days of post-op care.
But hold on, you really need to watch out for the special global indicators. I'm telling you, these are classic exam traps. XXX means the global concept just does not apply at all. YYY means it's unassigned or basically left to carrier discretion. And ZZZ, those are your add-on codes, which are always linked directly to the primary code's global period. Definitely take a second to memorize these three.
All right, let's shift gears for a second and see how this builds our coding strategy. We know the rule now, right? So we need to learn the exceptions. Because how do we actually get paid for those distinct non-routine services that just happen to occur during a global period? Well, the answer is modifiers. Think of modifiers as the specific keys that break the global package lock. First up, we have modifier 24. This is used for an unrelated EM service by the same physician during a post-operative period. The absolutely crucial word here is unrelated. Listen carefully to this. Do not, under any circumstances, use this for routine post-op follow-ups. Doing so is a massive compliance trap and could absolutely be considered fraudulent billing. The new problem has to be completely different from the original surgery. Next up is modifier 57. Think of this as your decision for surgery modifier. It applies specifically when an E&M visit directly results in the decision to perform a major 90-day surgery within the next 24 to 48 hours. This is completely different from just routine pre-op clearance, right? It's used for that exact encounter where the critical decision-making actually happens.
Then there's modifier 25, and honestly, this one gets heavily audited in the real world. So the crucial point is, the EM service must go far beyond the typical pre-op evaluation, and it happens on the same exact day as a minor procedure, meaning a 0 or 10-day global. It just absolutely must be a significant, separately identifiable service.
Okay, now let's talk about the surgical exceptions. Modifier 58 is for a staged or related procedure done by the same physician during the postoperative period. Here's a pro tip. If you see the words planned or staged prospectively in a test scenario, your brain should immediately scream modifier 58.
Now contrast that directly with modifier 78. This is for an unplanned return to the operating or procedure room by the same physician for a related procedure. The huge emphasis here is on the word unplanned. We're talking about an urgent situation, usually due to a complication, like a sudden postoperative hemorrhage or an anastomotic leak that literally forces the surgeon to rush back into the OR.
And that brilliantly illustrates our final major exception, modifier 79.
This is used for a totally new, completely unrelated procedure by the same physician during the postoperative period. For example, say a patient is in a 90-day global period for knee replacement, but then suddenly needs an emergency appendectomy. It's a new problem, it's an unrelated surgery, so you use modifier 79.
All right, we've covered a lot today, so here is your summary. I highly recommend you pause the explainer right now and literally take a screenshot of this high-yield cheat sheet. It boils down the entire global package for you, what's actually included, the 0, 10, and 90-day timelines, and exactly which modifiers break the rules for both EM and surgical exceptions. Seriously, this is your ultimate survival guide for the exam.
Well, you've officially mastered the surgical package. But coming up next in Part 24, we are dropping a massive CPT modifiers masterclass. We'll be breaking down key modifiers 22, 25, 26, TC, 50, 51, 59, and those extremely tricky X modifiers. So, want to know the exact formula to bypass National Correct Coding Initiative, or NCCI, edits without ever triggering an audit? You definitely won't want to miss it. Keep studying hard, and I'll see you in the next explainer.